We go about our daily lives making inferences about the goals and mental states of others. However, while this process may come as automatic for most of us, this is not the case for individuals with autism spectrum disorder, a neurodevelopmental disorder characterized by deficits in communication and behavior. The mirror neuron system is a collection of cortical neurons theorized to allow one to understand the intentions of others from observation of their actions. Conversely, the broken mirror theory of autism claims that a dysfunction of the mirror neuron system may be a cause of poor social interaction and cognition in individuals with ASD. Current research suggests that reduced activity in the mirror neuron system, specifically in the inferior frontal gyrus, was posited to be the reason for poor social skills in individuals with ASD. Nonetheless, existing research has provided inconsistent results to prove the role of mirror neuron system in social behavior. While some studies suggested that reduced activity in the inferior frontal gyrus is responsible for the impairments of social skills such as empathy, action understanding, and imitation, others posited that this reduced activity is not necessarily related to poor social skills. It is worth mentioning, however, that these existing studies were all conducted with small sample sizes. The current study thus aims to use a larger sample size to test the falsifiability of the broken mirror hypothesis, specifically to identify if there is indeed a dysfunction in the mirror neuron system in individuals with ASD by looking at the activity in the inferior frontal gyrus during action observation, and finding out if there is an association between activity in the inferior frontal gyrus and social skills in individuals with ASD. In order to do so, 60 individuals with ASD and 60 neurodevelopmentally normal individuals, matched for age and gender, will be recruited for this study. Prior to the actual study, the Stanford Social Dimension Scale will be administered to a parent or guardian of each participant. The SSDS is used to assess one's social skills across several social dimensions, with higher scores reflecting better social skills and lower scores reflecting poorer social skills. During the actual study, participants will be required to watch a series of videos showing succeeding goal-directed hand movements to elicit response in the mirror neuron system. These videos include a static hand beside a cup, a pantomime grasp beside a cup, and a transitive hand grabbing hold of a cup, during which activity in the mirror neuron system will be measured by administering transcranial magnetic stimulation to the primary motor cortex, and thereafter observing cortical spinal excitability as reflected by motor evoked potential, a form of electromyography response in the target muscle. Consistent with existing studies, it is expected that results will show reduced activity in the inferior frontal gyrus during action observation in individuals with ASD. In addition to that, it is also expected that there will be an association between reduced activity in the inferior frontal gyrus and poorer social skills in individuals with ASD. Consequently, if the expected results are observed, the findings will reaffirm the broken mirror theory that postulates a dysfunctional mirror neuron system in individuals with ASD. The results will also provide support for the negative effects of the broken mirror theory on social functioning, such that poorer social skills in individuals with ASD is related to significant reduced activity in the inferior frontal gyrus during tasks involving mirror neurons. Taken together, the expected findings from this study suggest that the mirror neuron system serves as a neurological network responsible for normal social functioning and behavior in humans. And this provides a strong reason for identifying intervention and treatment methods for autism. Clinical practitioners who work to identify ethical and non-invasive methods to stimulate the mirror neuron system and permanently improve its activity, thereby possibly elevating social relating impairments. However, despite these expected outcomes, there will be a limitation to this study. Findings from this study cannot be used to infer causality, as it is still not possible to determine if a dysfunctional mirror neuron system is the cause of poorer social skills in individuals with ASD. Hence, this calls for future research on the neurobiological causes of ASD and the brain regions beyond the mirror neuron system that are responsible for social functioning and social skills.